You're joining me today with the sunshine like I've got here, and I hope you're all keeping well. So if you've already seen our advertisement for this live today, you'll know that I'll be talking all about night pain and AS. Now, this is a huge topic, so I'm not unfortunately going to be able to cover everything and solve everything, because it is a real problem in AS for a lot of people. But hopefully we'll go through a few different ideas that you'll find helpful, maybe mention something you've not tried before, and I'll also be able to answer your questions as well. For those of you who haven't met me before or seen one of the lives before, my name is Zoe Clark. I'm an osteopath, and I've joined NASS to help them on the helpline and with their social media during the COVID-19 outbreak, particularly because it's obviously difficult getting to appointments at the moment and accessing different support, so we're able to step that up for everyone. I also live with AS myself, so I can bring some of my own personal experience into things, and personally, night pain is something that I find quite difficult to manage at times. But like many things with AS, it waxes and wanes overnight. So hopefully I'll be able to bring in some of my personal experience to give you some ideas to help as well. So the video will be staying up on our page. So if you aren't able to stay for the full discussion, that's fine. You can check back later on and it'll be staying on there. And I think we'll upload it to our YouTube as well. Feel free to ask any questions, drop them in the comment box and I'll answer as we go along. Or even just pop in your suggestions of what you found has helped you for night pain as well. And of course, if you want to get in contact with me directly, because I'm able to offer advice in terms of exercises and different things you can do to help manage your AS, you can get in contact with me either on the helpline or directly. Just drop me an email, zoe@nass.co.uk. Hi, Francis. Thanks for joining. Yes, yeah, it can be really horrendous at night. So hopefully we'll be sharing some things that you haven't tried so far and things that you find helpful. So, as I said, night pain with AS is a huge topic. It's not something that often we find is easy to fix, but it can sometimes be finding the right combination of things that work for you. So this really is just about bringing in different tools that you may not have thought of or tried before and hopefully making a difference. It's also important to note as well that the symptoms can fluctuate over time as well. So something may well be working for you, and then you find that later on it sort of loses its effectiveness, which is when you can come back to this video, or we'll put a blog post up as well, and you can look at the other tools and try different things as it changes over time. So firstly, a little disclaimer, night pain sometimes is caused by AS, but obviously it is something that if it's a new night pain for you, or if it's especially severe, it's worth speaking to your doctor and getting things checked out just to ensure it is AS related. And then if it is AS related, hopefully we're going to cover it and give you some advice here. So what actually causes night pain in AS, and why is it more severe during the night? Well, AS is an inflammatory condition, so it means your body is producing inflammation. And overnight, when you're still and you're not moving as much, that inflammation can settle in those areas and cause that stiffness and pain, which is why one of the big things that we recommend is exercise and keeping moving. But of course, when you're still in bed overnight, there's only so much movement you do, so often those symptoms will get worse during the night. So really, in terms of actually reducing night pain, you want to make sure that your AS is as well controlled as it can be. So this obviously is in discussion with your rheumatologist, looking at the different ways that you're managing it. But really, if your AS is as well managed as possible, that will make a big difference to reducing the night pain you're experiencing. A way that I find it helpful is to track symptoms over time. So there are a couple of apps available. We'll drop the links in the comment box as well for you to take a look at later. One in particular is My SpA, and the other one is AS Symptom Tracker. So you can get them on the Google Play Store and the Apple Store as well. But again, we'll drop the links in the comments. But it can be really helpful to track your symptoms over time, because then when you go and see your doctor or you have a review, anything like that, you're able to look at things over a broader time period. And also it serves as a memory jog for you as well. So it helps identify if maybe the symptoms aren't quite as well controlled as they could be, and your rheumatologist may want to change how you're managing things. Because it's really difficult if you only see someone every 6 months or 12 months. It can be really hard to recall how things have been, so it's a great way of keeping track of things. If you don't want to use an app, you can just jot it down by hand. So doing maybe daily or weekly, doing a score. The particular score that rheumatologists are particularly interested in is BASDI, which you can check out on basdi.com. And you can just fill this in weekly or fortnightly and just jot it down, and it's able just to keep a track of things over time and make sure things are managed as best as they can be. So in terms of reducing the likelihood of experiencing the night pain, as I said, managing the actual inflammation and the actual condition is a big step towards this. But other things that you can do other than the medications is by exercising regularly throughout the day to help reduce that inflammation and control the condition a lot more. So we've got a lot of exercises on our YouTube channel that you can check out. And again, I'll drop these in the comments. But also just doing some home exercises or walking. And obviously when pools are open, swimming can be really helpful as well. Keeping the muscles around the joints all stronger is going to be helpful as well to reduce the likelihood that you're getting night pain. So it's worth trying to incorporate these exercises. If you're struggling with pain at the moment and it's leading to worse fatigue, then it can be really difficult to bring exercises in. I would recommend just picking one or two very simple movement exercises, probably similar to the seated ones that I discussed in the last video, the working from home video. So they would be sitting and just turning side to side to get your spine twisting, and just tilting either way as well, and then arching upwards and then bending down. These would be really good movements to incorporate, because even if you're fatigued, you're able to incorporate them little and often. So I wouldn't recommend one long, intense exercise session. I just bring these movements in little and often throughout the day, so you're not aggravating the fatigue, but you're hopefully helping reduce that stiffness, reduce the pain, and it's going to make the nighttime more comfortable as well. So in terms of, I get a lot of questions about mattresses and pillows to be using. As an osteopath, patients ask me about this all the time, particularly with AS. We often think, I'm getting pain at night, it's probably because of my pillow or because of my mattress. Sometimes this is true, but sometimes it is just the nature of the condition as well. So I am really clear with people when I'm recommending changing mattresses or changing pillows. Unfortunately, it's not guaranteed to help, because it may well be that it's actually just the disease itself is flaring up at night. It can be worth experimenting and trying different types to see if it works well for you, but unfortunately it's not a guarantee. Most commonly, anecdotally, I would say that the most common mattress that people tend to find helpful is a medium to firm mattress, and then using a small mattress foam topper on top of that. So with the medium to firm mattress, you've got that underlying support for your back, but then you have the foam topper on top, which provides comfort when you're lying on your side for your shoulders and for your hips, which can be really helpful, particularly if you get a lot of tenderness in the muscles around the shoulders and hips. Having that added padding can be helpful. So it's worth just shopping around. Obviously, when we're not in isolation or anything like that, then you'll be able to try out different beds. And even if you go to the shop, I recommend laying on them for sort of 10-15 minutes to get a good feel for them, because sometimes they can feel fine at the time, and then the longer you're on them, you start noticing that it's maybe not as comfortable as you think it will be. Francis saying, my SI joints are the worst, but also hands and feet too. Yeah, it's something actually that we don't cover very much with AS, because mainly it is the spine and the SI joints that are affected, but with hands and feet as well, you can get a lot of pain and discomfort with these. So again, the same kind of recommendations apply. So just doing gentle movements. So with your hands, you can just move the wrists like so, opening and closing your fingers. It's just getting that movement and reducing the stiffness there, and getting the inflammation moving around as well. With your feet, again, you can roll your ankles into circle movements both ways, and also bending and straightening your toes. And you can even, if it's comfortable to, and if you're mobile enough, you can even sort of hold the foot and move it around a little bit. And the same with the hand, you can just hold it so that the actual hand that you're moving is relaxed, and then the other hand is doing the work. That can be quite comfortable as well. Doing those exercises just before bed sometimes can help reduce the stiffness and pain that you're experiencing, so it's worth trying them out. So back to mattresses and pillows. So in terms of pillows, I generally would recommend a pillow that is supportive for you but isn't too high. Again, just experiment and find what works for you. Normally, I would recommend that when you're lying on a pillow, imagine that you're sat upright looking straight ahead. Ideally, you want the pillow to fit the space between your head and your shoulder, so that's where the mattress would be. So you just want that correct height there, so that when you're lying on your side, your head is nice and neutral in that neutral position like so. One way to do this, because sometimes people find that they get a pillow that's comfortable for their head, but then they end up with this gap in the neck and they have to scrunch their shoulder up or just tilt the head over like that to provide that added support, which short term can be absolutely fine. And for many people without a condition such as AS, that's absolutely fine. But sometimes you can end up feeling like a bit of a crick in the neck, get tightness in the shoulder muscles, and even sort of feel some nerve pain from the neck going down into the arm as well. So you can get these sometimes quite expensive shaped pillows where they are built up on one edge and then they come back flat again. The idea is that the built up part sits in the small of your neck and then the pillow slopes down so that it's the correct height for your head. A way that you can try out whether this sort of shaped pillow will work for you, because obviously if it's expensive you don't really want to buy it and then find that it's not helpful. So you can trial it out using a hand towel and a regular pillow. So I recommend with the hand towel you want to roll it up. This is live demo, I feel like the pressure's on. You roll it up lengthways. So you've got lengthways with the towel like that. And then you want to thread it inside the pillowcase along the long edge of the pillow here. So I'll just do that out of shot. Perfect. So you'd have something like this, where you've got the towel along the long edge here and then the rest of the pillow here. So the idea is that when you're lying on your side and you have the pillow here, you've got the towel along here, which will sit in the small of your neck, and then the rest of the pillow here, so that it's actually at the correct height. Let's get up, there we go. So at the correct height. So because if the whole pillow was the same height as the towel here, it would end up pushing my head up a little bit and it wouldn't be in that neutral position. Whereas here, you've got the added support in the neck, and then you've got your head relaxed here. So really that's a great way of practicing and just trying out whether that works for you. You can try it for a few nights in a row and just see if it's helpful. Or if you get a lot of pain in the neck, I'd recommend trying it out when you have maybe like a 20-30 minute nap, because then if you do find that it's uncomfortable, you're not going to have spent the whole night lying on it. So worth just giving that a try and seeing if that's helpful. Let's see, I'm just going to check the comments and just see if there's anything else I need to answer so far. Yes, Heather. Heather's asking if I recommend having a pillow between the knees. This can be really helpful. So it helps keep your back in a comfortable position, but also if you get any tenderness in your knees or in the muscles around the knees, it can be really comfortable as well. So sometimes just using a regular pillow like this between your knees is helpful. I've even seen on Amazon that they do make them where they've got Velcro straps around them, because once you're asleep and you're moving, sometimes the pillow can end up all over the place. But if you find that long-term a pillow between the knees is helpful, you can get really reasonably on sites like Amazon, you can get these long whole body pillows. Often they're recommended for pregnancy, but they're great for AS. So it can be where the pillow is long enough that you have it under your head and your neck, then it comes down, and then you can have it between your knees, then even threading it along your shins that is between your ankles as well. That can keep the lower back in a really comfortable position. So if you're getting a lot of low back pain or pelvic pain, that can be worth a try as well. Particularly as they're quite good for on a budget, you can try them out because they're just, foam pillows. So that's very, very good idea to have a pillow between the knees. So Belinda's asked about just having knee problems. So my kneecap is currently tracking, so moving from straight to bent is painful and horrible, big click. What should I do at night? So with that, I definitely recommend having a pillow between your knees. I'd recommend lying on your side with your knees slightly bent and then the pillow between them to keep it comfortable. If it's something that's ongoing, I probably would get in contact with someone like a physio or an osteopath. If you want to get in contact with me directly, I'll reply to your comment with my email address, but it's zoe@nass.co.uk. And we can have a chat on the phone and see if there's anything we can do, because it might be that with some exercises we can actually resolve that problem, but just get in contact if you need. But a couple of comments saying that a few people have tried with between the knees the pillow, and that's really helpful. Tommy's getting hand numbness during the night. So that's something, again, I'm happy to have a chat with you and see if we can work out what's going on with that and then see what we can do about it to help. But again, just drop me an email. Yeah, and Julie's tried a memory pillow and it was like a brick. Yeah, memory foam, both for pillows and mattresses, I found it's about a 50-50 split. Some people love them and some people hate them. It's a bit like Marmite. So I would recommend, normally I would recommend if you know someone with a memory foam pillow, ask if you can borrow it for a bit. But obviously at the moment that would not be recommended. So if you can look at companies where they have a money back guarantee, so you can try something for 30, 60 days, see if it helps, and then return it if it doesn't. That can be helpful. But yeah, memory foam is a bit of a love-hate topic, I find. Yeah, and lots of pain in back and ribs, sleeping. So sleeping for any length of time is difficult. My advice for that, I don't know if you've been here for the whole video, but certainly at the beginning, it would be definitely looking at whether your AS is controlled enough, whether there's anything else you can do to actually control the inflammation that's causing that pain when you're still. But then if not, going through all the tips through this video, and I'll follow it up with a blog post as well. So hopefully through this, I'll give some advice on exercise and things later on as well. So hopefully that will help. And Julie's tried the rolled up towel on the pillow and it works very well. Glad to hear it. Maria. So Maria said, that's okay if I stay on my side, but then when I go onto my back, my head is tilting backwards and that hurts too. Yeah, so that's a difficulty sometimes when you then lie on your back, you need a slightly different size pillow. So if your head's tilting backwards, your pillow's too low. So I'd recommend building the pillow up a little bit and just checking, get a slightly thicker pillow, or even just fold up a towel or a blanket to pop underneath it. And then just practice. So if you're lying on your side, either set up a camera or get someone to have a look at you and just make sure when you're on your side that your head's in that neutral position. It's not too high and pushing your head up. So that then when you're lying back on your back, it's the correct height for you. If you're using the towel in the pillow and that's actually pushing your head up, make sure that as you turn onto your back, you're keeping the towel in the small of your neck at the back there, so that it's not actually on the back of your head, because that will push it up as well. Let's have a look. So Lorna's having shoulder pain referred from her spine that's inflamed. Any advice? So absolutely, you can sometimes get pain referred from the spine into the arms or the legs. That's something probably worth us having a chat individually, Lorna. So drop me an email and we can discuss. I can arrange a call or a video call to have a chat through that. Because I would generally say exercises would be helpful, but I would just want to make sure that that's appropriate for you. Yep, and Barrett is asking, I can't straighten my left leg due to left hip fusion. Please suggest something. So that, again, we're going to do a video, Facebook Live, all about hip problems. So I'll cover that. But again, feel free to drop me a message beforehand, and hopefully we'll be able to go through some things that can help you specifically, because that is quite specific. So just get in touch, drop me an email. And Donna, can't stand my feet on bed, hurts my ankles, have to hang off bed. So if you're finding that having your feet on the bed is painful, there could be a number of causes for that, but you could try having it so when you lie on your back, have a pillow lying like so that you have your knees and your shins along the pillow, and then your feet are just slightly off the pillow, so you're still able to be on the bed. So say the end of your bed is around here, you can just have the pillow slightly higher, so you've got your feet raised up a little bit, but then they're still on the bed, they're not completely hanging off. I'd recommend trying that. But again, just get in contact with me if you want some more specific advice. Stuart asks, should I be in work with AS? I've ceased taking my anti-TNF, but never received a letter saying I'm high risk. If you have a look on our website, we've got all the information there about risk levels regarding COVID, and also our helpline number as well. So if you take a look at our advice on whether you're high risk or not, then and you're unsure, then just give us a call and we can have a chat through about your circumstances and see what risk level you would be. And Sue's asking about V-shaped pillows. Absolutely, these can be really helpful as well. The main consideration really is just making sure they're not too thin, so that when you're lying on them, your head's down like so. But they can be especially helpful if you are getting rib pain at night, which means that you need to be sat up a little bit more. They can be really good at just propping you up, because they can support the back of your shoulders if you have it in a V shape behind you, so it supports your head and your shoulders without putting too much pressure on your back as well. So that I would recommend that, definitely. Yep. Yep, and Jessica says that keeping her spine straight is key. So a pocket spun mattress, medium to firm but no foam, and then pillow under the side works wonders. That's a good idea as well, experimenting with the pillows under your body itself and just seeing how that helps. So I imagine that's like having the foam, but in a very specific place rather than over the whole mattress. Let's see. Yep, Liz will be going through hot and cold as well to help with that. And Julie's tried the memory foam shaped pillows at night, but she's still getting horrible neck pain. So again, I tried just with the towel because it's not as firm and is not as kind of abrupt a position as a proper shaped memory foam pillow. Give that a go, but if not, then experiment with a few different pillows. But again, just get in contact if you need any specific advice. So in terms of, so that's mattresses and pillows. Again, if you have any questions, pop them in the comments. I'll go through a little bit more advice now, and then we'll come back to the questions shortly. And for anyone who's joining partway through, don't worry, because the video will be remaining on our page, so you can go back and watch back later on. And we're also going to share all the information in a blog post again afterwards. So in terms of actually managing the pain that you're experiencing, so as someone just commented in the comment box, Liz, that she uses a water bottle, hot or cold. Absolutely. I really recommend, if you are having particularly difficult nights, try and get things as comfortable as possible before you go to bed. So using a hot water bottle or a microwavable wheat bag, wrap them in a towel just to protect the skin, and then pop them locally on the area that you're getting particular problems with, because having that heat there, or sometimes an ice pack, again wrapped in a towel, it can sometimes just soothe the area enough that you can get to sleep more comfortably. Obviously, sometimes this won't last all the way through the night, so if you have to, you may have to sort of get up and do the same application again. I would recommend not risking falling asleep with them on, because even if you've got them wrapped in a towel, there's obviously a risk of a burn either from the heat or ice burns from the ice as well. So if you're doing this when you're already in bed, I'd recommend setting a timer for 10 minutes so that you make sure that you don't fall asleep with them on. But sometimes just getting things more comfortable before you actually fall asleep can then ease things through the night and make it more comfortable overall. It's also really important to discuss with your doctor or with your pharmacist the medication that you're taking. So both painkillers and anti-inflammatories all work in different ways, and there are many different types. A lot of people respond well to anti-inflammatories like naproxen, but some people find that other anti-inflammatories are needed. There are some that have a longer effect and last a bit longer, and some that you can take before bed so that they work overnight. But it's something that is really individual, and obviously it depends on your general health and also other medications that you're taking. So I'd recommend, if you're unsure if the painkillers or the anti-inflammatories are working very well, then you have a chat with your doctor or your pharmacist and they can find what works best for you. It's always worth experimenting with different things. If you're finding that something's not helping, then have that conversation and discuss things. Obviously, I understand it's difficult at the moment because we've not got those face-to-face appointments happening. But if it's something you're finding really difficult, give us a call on the helpline and we can give some advice in terms of how you can get in contact. As well, in terms of different types of medications, in the comments advertising the post yesterday, we had a few people commenting that things like amitriptyline help for them. So again, there are different type of medications. They particularly help with nerve pain, but their side effects can include drowsiness. So some people do find that actually the side effects are quite helpful with that one. But again, it's just speaking to your GP or your rheumatologist and finding what works for you, really. Something I want to discuss as well is in terms of sleep medications and herbal remedies. So people do report that they use these and can find them effective, but it's something you have to be very careful with, particularly if you're already taking medication, or obviously with any other conditions as well. So these medications, they can lose their effectiveness over time. They also can become addictive as well, and they can come with side effects too. So it's something I would really urge you to look at every other option before pursuing this option. And if you are considering taking these, then speak to your doctor beforehand to make sure that it is suitable for you. So in terms of other causes of poor sleep, because obviously AS can cause poor sleep, but so many other things can as well. So really you want to look at your whole overall health and general lifestyle and see if there are any other things that you can do to help reduce the difficulty sleeping. So stress and anxiety is a big one, and I know a lot of people are experiencing that at the moment, and that's completely understandable. But finding ways that you can help cope with that and help manage the stress and manage the anxiety so it's not having a physical effect on you can be really important. World AS Day is coming up, and the focus at the moment is for this year is going to be on mental health. So we've got some great sessions coming up all about mindfulness and about managing stress as well. So do keep an eye out for those. But if our original Facebook Live that I did a couple of weeks ago, if you look back on the rib pain and breathing exercise video, a few of those breathing exercises I mentioned are particularly good for anxiety and for stress. So do look back on those or check the blog post on our website as well. So it's well worth trying a few different techniques that may well work for you, help reduce the stress, reduce the anxiety, and let you drift off into a better sleep. And in terms of particular things, mindfulness and using apps like Headspace can be really helpful as well. So I'd really recommend that. And sleep hygiene is something that you may have heard of. In terms of what sleep hygiene actually is, it's not specific to AS, but I think it can be really relevant. So sleep hygiene and good sleep hygiene is how we refer to different practices we can do to help promote good sleep. It really focuses on the natural sleep-wake cycle that our bodies have. This is controlled by hormones that our body produces, and we can influence those hormones by different things, such as doing things to create wakefulness and get light during the day to get the hormones going that help with the wakefulness part of the cycle. And then we can also help prepare our bodies for sleep by helping in the evenings with other things that help produce the hormones that create that sleep part of the cycle. So the most important technique to help manage this is we want to keep a consistent sleep-wake cycle. So we're getting those hormones consistent as well as our daily time. So we recommend getting up at the same time each day and going to bed at the same time each day. Obviously, I know this can be difficult depending on your lifestyle and your commitments, particularly if you've got children or anything like that. So it can be difficult, but it's worth just trying and seeing if it is helpful for you. If you are trying this out, I'd recommend giving it a good month, because it can take a little while for the effects to come in. But if you try and do this consistently for around a month and see how things change, and then you're able to tell whether it's working for you or not. In terms of helping promote that wakefulness and help produce those hormones in the wake part of the cycle, the best things you can do is to get out into the sunshine and into the daylight as much as you can. If you're not able to go outdoors, and even just standing by the window and just looking outside, particularly sort of longer distance, and just the sunlight that gets those hormones produced that help you with that wakeful part of the cycle. Exercising can be really helpful for that as well, particularly something that gets your heart rate up and gets the adrenaline going. So again, we've gone through a few exercises, and I know in the coming weeks we're going to be sharing different ones you can do, particularly in isolation to get your heart rate up. But some particular ones that can be really helpful, even just doing star jumps on the spot, doing step-ups down on the bottom step if you've got stairs, and just brisk walking around the house if you are indoors, or obviously getting outside for a jog or a brisk walk can be really helpful. Going on to the sleep part of the cycle to help promote that sleep part and get the hormones going, which help prepare you for nighttime. The best thing you can do is in the evening, particularly around sort of an hour or so before bed, dim the lights so that you haven't got too many bright lights, and also try and avoid screens. That includes TVs, phones, and games as well. You also want to keep your bedroom dark and cool. So again, you're promoting that sleep part of the cycle and getting the sleep hormones going, and try and reduce distractions as well. And obviously avoiding caffeine just before bed can be helpful, and also avoiding those exercises I said that are getting your heart rate up and getting the adrenaline going. You can do some more calming exercises, so like breathing exercises, and yoga nidra can be really helpful, and tai chi can be really helpful as well. Anything that just promotes that relaxation and is quite calming, doesn't get the adrenaline going. And a hot bath or a hot shower, warm drink, and some relaxing music can be really helpful as well, particularly if you're finding that stress and anxiety are affecting the quality of your sleep. That can be really good just to help promote that relaxation and get the sleep hormones going and help prepare you for a good night's sleep. So that's everything in terms of my specific advice, but as I said, this is a huge topic. So I'll go back in the comments and just see if there are any questions, or if there is any other things that people have find helpful. I will go back as well to the, as I said at the beginning, The main thing with night pain is just making sure your condition is as controlled as possible. So absolutely just make sure that that is the case. But if you do find that you're sort of covering all bases in terms of the actual control of your condition, then these tips can be really helpful. So do let me know any comments, anything that particularly helps for you, or if you have any questions at all. Let's see. So I can't see their name, but someone replied to Lorna and just said, I have exercises. I think it's Lorna. Lorna has exercises from her physio, but they're too painful. Definitely get in contact with me and we can go through. It may well be that we can make the exercises a bit more gentle to begin with, and then you can build up to the other ones in time. Usually there are lots of adaptations that we can do. Tommy asks the best pain relief at night. That unfortunately that varies between people, so I wouldn't be able to recommend anything in particular, but definitely speak to your pharmacist and see what they recommend in terms of pain relief. But certainly the other things that we spoke about non-medication wise, so using heat or ice locally, and you can even have like an electric blanket on the bed to help with the heat if you need that over a long period of time. But yeah, definitely speak to a pharmacist about the different options for that. Let's see. Jessica says, I haven't taken any meds for 4 years. I was told not to come off NSAIDs, the anti-inflammatories, as I would just flare up, but I've been fine. The key being getting through the night without pain, therefore low inflammation in the morning, and you're in a positive cycle. Absolutely, yeah. So if you're able to get the actual condition controlled, that can be really beneficial so that you're not needing those anti-inflammatories. But everyone's completely different, so it depends entirely on each person's condition and often when they've been diagnosed as well. But yeah, hopefully getting the actual inflammation controlled will help with the pain. Hi Tim. And Jessica, Jessica finds amitriptyline is good for sleep. And that's a good tip as well. She takes it about 2 hours before bed to avoid drowsiness in the morning. Everyone responds differently in terms of if they get the drowsy effect from these types of medications. But if you do, then taking it a bit earlier means that often you wake up feeling more alert and wakeful. And absolutely avoid sleeping in the day can be really helpful. If you're experiencing a lot of fatigue, it can be helpful to have like a short 20-30 minute nap. But if you're practicing that sleep-wake cycle, try and keep it to only 20-30 minutes and try and keep it at the same time each day if you are going to do it. Again, it just gets your body into that natural rhythm. Rebecca recommends electric blankets, absolutely. And try putting your pillow down under the duvet when you switch the blanket on and fish it out just as you get in. A warm pillow is great for getting to sleep with a painful neck. That is a brilliant suggestion. Thanks for sharing that, Rebecca. I'm definitely going to be trying that. That sounds lovely. Sue has to go, but do check back later on because we'll be keeping the video up. Belinda, thank you, Belinda. That's really kind. Yeah, absolutely. So some people are mentioning that their mood's been really affected. It is a huge thing that if you're not getting the right sleep, you're not feeling well rested when you wake up, and you've got the fatigue associated with that, even if your pain isn't more severe that day, it's going to make it a lot harder to cope with. And obviously just doing day-to-day things, if you're exhausted, it is going to have a really big effect on your mental health. So I would say definitely speak to someone. If you've got someone that you're close to, that you trust and can speak to about it, that can be really helpful, even just talking about it and getting it off your chest. If you don't have anyone, then even speaking to calling the Samaritans. It's all anonymous. It's a non-religious organisation, but it really is just people trained to be there to listen, and it can be really helpful. But definitely over the coming weeks, we're going to be sharing more about mental health and AS because it is a huge thing, and it's the theme of this year's World AS Day as well. So hopefully we'll share a few things that can be helpful for you. So Fabio asks about any particular time to do the exercises as part of helping the sleep cycle. Absolutely. So hopefully I went through that. It may be that you just joined, but if you try and do them, so anything that is getting your heart rate up and getting your adrenaline going, so like I said, with star jumps, step ups, brisk walking, you want to do those during the day. So basically any time up until around an hour before you're planning to go to bed. Keep those kind of exercises for that. And then in that hour or so beforehand, or even just the beginning of the evening, then you want to be doing the more relaxing exercises that aren't getting your heart rate up too much. So I mentioned Tai Chi, Yoga Nidra, and breathing exercises as well. Yep, and we've got some more ideas in terms of amitriptyline that could be helpful. And caffeine before bed, it really varies. It depends on how much you're having throughout the day, and also just generally, naturally, how you process the caffeine as well. I would experiment with this, but normally, I think on average, we say up until around 2 p.m. But some people say earlier than that. Some people say a little bit later. So it's just experiment with it. Practice going up until about 2 p.m. and then see if that makes a difference for you. Lindsay's starting to flare quite badly and the night is the worst. So hopefully the advice in here has been helpful for you. Let me know if you have any particular questions on the end of the phone on the helpline, or you can email me as well and we can organise a call, or just just chat by email. So again, my email address is zoe@nass.co.uk. So I hope that's been helpful for everyone. I will be checking back on the comments, and as I said earlier, I'll be popping in links for things like our YouTube channel and the symptom tracking apps and so on that I've referred to in this. But we will be posting a blog post later today as well, going through all the advice as well. So yeah, do let us know if you have any other tips, because we can include that in the blog write-up to share with everyone. But our next Facebook Live is going to be next week. It's going to be Tuesday instead of Wednesday. So next Tuesday at 1 p.m, I'm going to be going through gardening with spondyloarthritis. Because next week is National Gardening Week. Hopefully we've still got the sunshine. It'll probably be typically a very rainy day when I'm going through my gardening advice. But hopefully I'll be able to help you get in the garden much more comfortably. Also, it's worth us mentioning, if you haven't seen already, check out our post all about the 2.6 challenge. So this is a challenge that a lot of charities are doing at the moment, and it's something hopefully lots of you can get involved with, either sponsored to help raise money for NASS if you're able to, or even just doing it in terms of helping you get out there and get active and just do something that's part of a community as well. So everyone here at NASS, we're all doing our own challenges as well to help join in and give you all the support as well. So personally, I'm going to be doing a yoga themed challenge. So I'm going to be doing 26 sun salutations. Luckily for you, I'm not going to be doing it on a Facebook Live, but I will be posting a video or release some pictures of me doing it when I have done it, just as proof as well. But yeah, I'm going to ask family and friends to sponsor me to help raise some money for NASS, because obviously it's a difficult time for charities all over the world at the moment. But yeah, so hopefully you'll all join us in that. We'll pop a link again to the 2.6 challenge webpage in the comments below. And hopefully you can get involved as well. It'll be something fun to do and something positive to focus on as well. So thanks for joining, and let me know if you need any help. I'll see you next week.